Abby, my name is Lauren. I'm going to be doing a couple of assessments on you today, including respiratory, cardiovascular, peripheral vascular, and your abdomen GI system, okay?
Okay.
Do you have any questions?
No, ma'am.
Okay, so I'm going to start by observing your general appearance, no excess work of breathing, no accessory muscles. I don't see any cyanosis. Your trachea is midline, and I don't hear any wheezing. So I'm going to just kind of start breathing just a little bit deeper than normal. Okay, everything looks good. I'm also going to observe your anterior, posterior, and lateral chest for symmetry and expansion. Okay, all right, no asymmetry there. Now I'm going to palpate bilaterally in between your ribs. I want you to take a deep breath. Okay. Any tenderness with that?
No.
One more time. All right. No retraction and no tenderness there. I'm going to now percuss on the back and in the front in multiple areas to see if I can find any areas of consolidation, okay? Any tenderness?
No.
Base of the ribs. No issues there. Okay, now I'm going to start up top. Okay, a little bit lower. No tenderness as I'm doing this?
No.
All right. Okay. I'm going to now listen in the same areas that I just percussed, but I want you to take big, deep breaths with your mouth open, okay? I'm going to listen for any adventitious sounds, crackling, wheezing, rales, rhonchi. Okay, big, deep breaths. Okay. Again. 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 All right, base of your lungs. No crackles, wheezing. In the front, same. Mouth open, big breaths. Okay, no abnormal sounds. Clear. Okay, lung sounds are great. That concludes the respiratory part. So now we're going to go on to the cardiovascular assessment. I'm going to have you lay down, and I'm going to take a look. I'll describe what I'm looking at as I go. Okay, yes, I want you at a 30-degree angle. And I'm going to be looking at the side. If you'll turn your head just a little bit, I'm going to look for any jugular venous distension. I'm going to find the jugular venous pulsation, carotid pulsation. Okay. All right. Other side. Okay. Great. All right. You're going to remain laying down. I'm going to now measure the JVP, okay, so yes, turn your head all the way over. I'm going to lay this flat with the sternal angle. Okay, and measure there too. Turn your head a little bit more. Okay, great. It's right at about 3 centimeters. That is great. I am going to now feel for some pulses, okay? I'm going to feel for a bilateral carotid pulse. That's great. 2+ pulses there. Okay, I'm going to look for your chest place of maximal impulse. Okay. All right. And if I'm having difficulty finding this, I'm going to have you lean to your left side. So kind of roll this way for me. Okay. I'm going to feel lay flat again. I am going to kind of palpate up here on the left sternal border around the areas of your heart that you would be able to feel in between your ribs, okay? Go down here. Okay. Now I'm going to auscultate. So I'm going to use my stethoscope to listen to certain areas of your heart, and then I'm going to flip the stethoscope around and use the bell to assess for any like artery bruits, and it's a special sound that you can hear for abnormal pulsation in your arteries, okay? So I'm going to listen with the diaphragm, the aortic area, pulmonic, and I will continue down the left sternal border. I hear S1 and S2 sounds, no murmurs, no S3 or S4 sounds. Okay, we use the bell at the apex here. Okay. All right, I'll use the bell down here as well, the base of the heart. I'm also going to use this to check for bruits up top in your carotids. No abnormal sounds there either. So now we're going to move on to the peripheral vascular portion. You can sit back up for this. Okay, I'm going to start by inspecting your arms for size, symmetry, swelling, and the skin color. So I'm going to flip your arms over for me. No swelling, no redness, no rashes, no ulcers. Color's good, okay? Legs, I'm gonna do the same, size, symmetry, swelling, any edema. I'm gonna look for prominent veins, varicosities, if you'll stand up for me. Okay. I don't see any varicosities, no redness, rashes, ulcers, no dependent swelling. Okay, you can sit back down. All right, so now I'm going to palpate both arms and legs. I'm going to check for pulses. Great radial pulse. Okay, I'm going to look at the epitrochlear lymph nodes. If you'll flex 90-degree angle and go 3 centimeters, there's no palpable lymph nodes. Okay, all right, back out. The temperature is good, hair distribution is good bilaterally. Check this pulse. Radial is great. Same, let me check this. There's no palpable lymph nodes. Okay, back out. Color and hair distribution is appropriate. All right, I'm gonna check some pulses. If you'll lay back flat, I'm gonna check your femoral pulse, popliteal, and then your DP and PT pulses as well, okay? There we go. Femoral pulses palpable bilaterally. Popliteal palpable bilaterally. All right, both feet. DP pulses, great. All pulses +2 as expected. Okay, you can sit back up. All right, I'm gonna look at your nails. I know you have nail polish on, but we'll find, we can use kind of the back, the tip, to see how the color changes from, how quickly the color changes from white back to red when I pinch. All right, less than 3 seconds. Great. Nail beds look great. Toes, I'm gonna pinch the same way. Check for capillary refill. There's no delay, no edema. All right, everything is good there. Now I'm going to inspect your abdomen. I'm going to need you to lay down again for this as well. And I want you to lift your shirt up. There we go. Okay, I'm looking at your abdomen, contour, symmetry, skin color, any visible masses, umbilicus is in the appropriate position, not protruding. I don't see any visible areas that would indicate a hernia. I'm going to look at your, I'm going to listen to your bowel sounds. Okay. Go in a clockwise position, starting with the right lower quadrant. Okay, bowel sounds are normal active in all quadrants. I'm now going to percuss to feel, see if I can differentiate the border of your liver, and I'm going to do the same on the side of where your spleen is, okay? All right, so I'm going to start up top. Okay, I don't see any enlargement. Take a deep breath in. All right, hold for a second. Your liver is not protruding. Okay, exhale. Breathe normally. Okay, I don't see any signs of splenomegaly there. All right. I'm going to do light palpation around your abdomen. I want to know if you feel any specific areas of tenderness. Okay. Have you had any masses that you've come across? Okay.
No tenderness noted as well.
Okay. Great. I'm going to keep palpating, light palpation.
No tenderness.
Okay. All right. So now I'm going to do a little bit deeper palpation. I want to really find the edge of your liver. I'm going to do the same with your spleen. Then I will find your kidneys, and I'm going to palpate the area of your aorta, okay? All right, so really breathe in, big, okay, perfect. Okay, you can feel about 2 centimeters maybe protruding when you breathe in like that. Okay, I'm going to reach around. Any tenderness there?
No tenderness.
All right, no splenomegaly. Now I'm going to use my left hand. I'm going to pull your rib cage up and push down pretty hard and see if I can feel your kidneys on the back, okay? All right. Any tenderness there?
No tenderness.
All right. Try the other side. We'll lift your rib cage up. All right. I'm going to push down real hard. Any tenderness there?
No tenderness.
Okay. All right. Now I'm going to push deep. I'm going to find the width of your aorta, okay? Try to relax your abdominal muscles. No tenderness there either?
No tenderness.
Okay. Let's see. I'm going to have you sit up for me real quick. All right. Let me feel for any changes in positions there. No issues in the back?
No.
Okay. All right, well, that concludes this assessment. Yeah, you can sit up, you can pull your shirt back down, and thank you for your time.